Okay, Mrs. Jones, that's you done for another 6 months.
Okay.
If you just keep up with the brushing and the flossing, and we'll get you booked in again for another 6 months' time. Okay, thanks very much.
Thank you.
Are you all right, Mrs. Jones?
No,
If at any point the patient seems unwell, stop treatment, make the situation safe, get help, and locate your medical emergency equipment, including treatment algorithms.
Oh dear. Mrs. Jones?
Should the patient become unresponsive, or if you are at all worried, don't be afraid to activate emergency services early.
I think she might have fainted.
Oh, okay, I'll go and get the kit. Can we have some help in here, please?
Have you got the emergency
I'll
kit?
get the kit for you.
As the patient is not responding, we need to look in the mouth to check for any obstructions and deal with them appropriately.
Okay, let's get our legs up.
Airways clear.
What's happened?
Chris, can I ask you to dial 999 and ask for an ambulance?
Should the patient become unresponsive, or if you are at all worried, don't be afraid to activate emergency services early.
I'll open her airway. Do you really think we need an ambulance?
Well, I'd rather call for them and we can cancel if we don't need them.
Okay, good idea.
Yes, that's the correct address and telephone number. No, she's not conscious. Yes, she's breathing. I think she's just fainted, but I'm not sure. Okay, thank you. I'll look out for the car.
Oh, that's good chest movement, good normal breathing.
Count the respiratory rate. Attach oxygen saturations if you have it. Consider the colour of the patient and look for normal chest movement.
Oh, she's not picking up any sats. She does look a bit pale.
She does, doesn't she?
Hi, Chris. Can you get the patient's notes and start writing things down for the paramedic, please?
It is important to document what happened as it happens if possible, to ensure accuracy of times, drug doses and the condition of the patient.
I can feel the pulse up here.
I can't pick up the saturations.
Feel for pulses, assess capillary refill time and check blood pressure if you have the equipment. Also feel the skin temperature.
Capillary refill time is 2.5 seconds peripherally.
That's 2 seconds centrally.
Her blood pressure is 90/50.
In disability, assess level of consciousness by using the AVPU score. Check the patient's blood sugar levels, and if they're conscious, ask them to move their limbs to look for any signs of weakness.
Chris, is there anything in the notes about the patient's past medical history?
Exposure of the patient in the dental setting can be difficult, so whilst respecting dignity, look for signs of rashes, bleeding, injury or bruising.
Hello, paramedic here.
Oh, hi, thanks for coming. I've asked you to come and see 60-year-old Mrs. Jones. She came to us for a dental checkup and she's collapsed. I think she's fainted. On assessment, her airway's clear. Her respiratory rate is 12. I can't pick up on a saturation for her, I'm afraid. I think it might be her blood pressure's a little bit low, 90 systolic. Capillary refill time is 2 seconds. Her pulse is 50. Blood sugar of 4.5. On exposure, there's nothing of note. I wonder if you could come and assess her and make sure we're doing the right things, please.
Okay, thank you. Can you get me a copy of those notes?
Certainly.
And would you look after her airway while I just listen to her chest again?
Sure.
And take another blood pressure.
Okay.
How are you feeling, Mrs. Jones?
So, in summary, if someone faints, stop dental treatment, make the situation safe and position the patient flat with elevated legs. Assess the patient using the structured airway, breathing, circulation, disability and exposure approach. Call for help and give high flow oxygen with the correct oxygen mask. Use algorithms to remind you of the treatment guidelines. If the patient doesn't recover quickly or you are at all worried about them, don't be afraid to call for the emergency services. Prepare for your handover and document what happened as it happens and debrief your team after the event.